Hello everyone. The topic of today's lecture is Occupational Health Hazard and Safety. The topic as mentioned has been divided into a number of following subtexts. These are Introduction, Purpose of OSH Work, Typologies of Hazard, Occupational Hazard on Global and Bangladeshi Perspective, Organizing Body and Existing Measures in Today's Society in Bangladesh, Recommendations, and the References. However, before we move on to the details of occupational safety and health systems and hazards, it is important for us to understand what OSH really is. Occupational safety and health, in abbreviation OSH, is generally defined as the science of the anticipation, recognition, evaluation, and control of hazards arising in or from the workplace that could impair the health and well-being of workers, taking into account the possible impact on the surrounding communities and the general environment. A common question that would arise is, what exactly is the purpose of OSH? If we were to put generally, the purpose of OSH is essentially removing or minimizing the cause of accidents and other events in the workplace which may have adverse effects on employees. Now that we know what the purpose of OSH is, it is important to understand what kind of health hazards may be there in workplaces. Potential health hazards can be air contaminants, chemical hazards, biological hazards, physical hazards, ergonomic or spatial hazard, psychosocial factors, and accident factors. If we were to give some global examples of such occupational health hazards, we could come down to a number of them. For instance, in August 2014, explosion at a factory in China killed some 75 workers. In May 2014, fire at a coal mine in Turkey killed some 301 workers. A garment factory fire in Pakistan killed some 289 workers very recently. Having looked at the global perspective of occupational health hazard worldwide, it is now time to move on to the context of occupational health hazards in Bangladesh. It has been found that in beeri factories, workers revealed that 19% of the workers had some form of respiratory problem. Amongst them, some 79% had bronchitis, 26% had asthma, and the remaining 10.5% had tuberculosis. If we were talking about tannery industries, it appears that a number of health problems among the workers include occupational dermatosis, that would be 39.5%, accident or injuries, 19.3%, heat cramps, 11.5%, low back pain, 14%, bronchitis, 3%, and smell disorders, 4.5%. Moving on to other aspects, chelocytes was highly prevalent, which was 65%, followed by contact dermatitis, 1.4%, fungal infection, and so on. And a large number of some 8,000 to 12,000 tannery workers aged between 30 to 35 years suffer from gastrointestinal diseases, dermatological diseases, hypertension, and jaundice, all of which could also be related to pollution. Having covered the generalized occupational health hazard context of Bangladesh, it is now important that we move on to some specific examples of occupational health hazards in Bangladesh. Mostly it turns out that it is the industrial areas or the industrial locations and factories which generally happened or tend to have occupational health hazard conditions. Examples would be fires at the Tazreen Fashions at Ashulia, a fire at Smart Export Garments in Mohammadpur, or the fire at Aswad Composite Mills resulted in the death of many workers. However, the most important one, or the most dangerous one so far, has been the collapse of the 8-story commercial building in Savar, the Rana Plaza, which ended up taking over 1,135 lives, which probably is the biggest example of occupational health hazard situation in Bangladesh. Considering the different types of occupational health hazards existent in Bangladesh and in global perspective, it is obviously understandable that there are several safety services and measures which are allocated to different factories and work areas in Bangladesh and in global perspective. Particularly in Bangladesh, there are a number of services and organizations which work towards occupational health and safety. These services are as follows: the Department of Labor under the Ministry of Labor and Employment, Ministry of Textile, Jute, Agriculture, Energy and Mineral Resources, Ministry of Transport and Communications, Shipping, Aviation, Ministry of Home Affairs, Ministry of Local Government, Private Sector, and the Ministry of Health and the International Labour Organization Country Office for Bangladesh, together with these service systems and ministries, work to foster a preventive safety and health culture by strengthening national occupational safety and health systems. These include support in the following areas: development of a national OSH policy, national OSH profile in 2002, which was updated, promotion on ratification of the Occupational Safety and Health Convention 1981, as well as Occupational Health Services Convention in 1985 and Private Employment Agencies Convention in 1997. Capacity building of the key OSH stakeholders, promotion of safe and environmentally friendly ship recycling, and promotion of better working conditions in the Having covered the basic definitions of occupational safety and health, occupational health hazard typologies, the different hazards in global and local perspectives, and the existing interventions that are there already in Bangladesh regarding occupational health hazards, we now come to the conclusion of our lecture, which we will be doing with a number of recommendations that will be taking place at different levels of organizations. These recommendations are as follows. At employers and labor union organization level, training, awareness, and motivation of both employers and workers regarding workplace safety of health can be ensured. Establishing the employers and union association as important agencies in training and dissemination of knowledge can be done. At national and government organization level, there should be an autonomous OSH institute for services. Rapid reassessment and readdressing of the existing legislations should also be done. National occupational safety and health policies should be framed and safety and health council should be established. Also, developing of data collection system, for example, regional occupational disease database. In addition, at policy level legislations can be done as follows: updating existing laws and reduction of inconsistencies, increasing effectiveness of the laws, focusing on small and medium-sized enterprises, formulating and promulgating OSH Act, incorporating workplaces with environment standards, biological monitoring, and formative medical examination schemes, incorporating provisions in the legislations for safety committees and safety officers, encouraging employment of occupational health specialists in industries, and finally, introducing safety audit. And at inspectoral level, the following can be done: organization of formal training program for all categories of inspectors for proper reinforcement of laws, and increasing frequency of inspections and ensuring proper inspection, monitoring, and vigilance in. Based on the legislations and laws existing in Bangladesh regarding occupational safety and health, these were our suggestions. Would you have any recommendation to add?